So, for instance, the good fats, the lean proteins, and the fiber need to be in your diet to counterbalance, in fact, outweigh the bad guys, which are the trans fatty acids, the saturated fats, and the sugars or high starches. And as you can see here, for most healthy adults, there is only one nutrient I would ask you to avoid, and that's the trans fatty acids. Saturated fats, like I told you, needs to be in your diet in some level. And the math is simple. Eat less of the bad and eat more of the good. So for saturated fats, you need it in your diet, but generally try to shoot for less than 15 grams. It is, however, I must warn you, dependent on your weight, so you can actually get away with 25 grams of saturated fat if you in fact weigh about 250 pounds. But I think 15 grams for many people is a reasonable goal. And just to reiterate, I'm not saying to avoid sugar and starches altogether. It just needs to be balanced by the good stuff, and that is really the name of the game if you want to optimize health and wellness. So the key here are the ratios. The ratios of omega-6 to omega-3s in your diet is very important. In fact, it's more important than just labeling things bad or good. What is the ratio of LDLs to HDL? I told you that you need to make your HDLs as high as possible and LDLs as low as possible. And for every gram of low fiber carbohydrate you take in, it needs to be counterbalanced by fibrous carbs. But what are we talking here? Well, as a rough estimate, in terms of the omega-6 and omega-3s, you can start to have heart protecting benefits if you consume 10 grams of omega-6 fatty acids for every 1 gram of omega-3s. Just shifting your ratio that way, actually, you start to see the benefits in terms of decreasing your risk for heart attack and stroke. In fact, compare this to the typical American diet, where the ratio is more like 20 to 1 or more in terms of how much omega-6 you consume relative to omega-3s. Now for LDLs, it must be balanced by higher HDLs, and I guess 2 to 1 is a rough estimate. You can certainly increase your HDLs, rather, the good cholesterol, by avoiding high amounts of sugars. Exercise can do this, and moderate amounts of alcohol can also increase your HDL. Remember that sugars have this nasty effect of decreasing HDL if consumed in high amounts. And then the carbohydrates. Shoot for as close as you can get to 3 to 1. And I would say that this is difficult. The 3 to 1 ratio of low fiber carbohydrates to fibrous carbs is a difficult order. That ratio came out of studies looking at Paleolithic diets, where it was a period of time before agriculture actually existed. So our ancestors ate more fiber, much more fiber than we do now, on upwards of 60 to 100 grams per day. Now compare this to a typical American diet, where we consume 22 to 1 ratio of low fiber carbs or starches to the fibrous carbs. And this is the reason why we have a lot of disease in highly industrialized nations, because the ratios are just shifted at such extreme degrees.